Hello. The pandemic we face is due to reach its peak in many of our communities over the next couple of weeks, and many dark times still lie ahead of us. But I hope you will take comfort, as I do, that you are part of a highly professional team that will get us through this terrible situation and continues to provide excellent healthcare to our patients, as well as focusing on keeping all our staff as safe as possible from COVID-19. I want to thank all of our frontline teams who have not only shown incredible courage in doing their bit in coping with coronavirus, but also continue to provide excellent services to our patients. I'd particularly like to pick out the heroic work of our HCAs and practice nurses who continue to provide essential services like baby IMS and anticoagulation tests. They are also busy doing welfare checks on our vulnerable patients as isolation champions. They're not only checking on the physical well-being of our patients, but making sure that they're able to look after themselves while in isolation and passing on the contact details of others who are able to support this vulnerable group while they are living alone in isolation. I'm sure our patients and their families and carers will be grateful for the support that our teams are providing in checking up on them and making sure that their general well-being is looked after in these difficult times. Our teams have also been incredibly positive in how they've handled the many changes our practices have had to bring in, and very understanding as to why these changes have had to be brought in so quickly and often with very little chance of consultation. I want to thank our senior leadership team, especially Nolene and Julie, for the strategic, successful implementation of these new ways of working. They've needed to put these measures in place while liaising with many different organisations, CCGs, NHS, England, CQC, to name but a few. No mean task in any way or form. I also want to congratulate you, each and every one of you, because despite all of these changes and the switch to telephone-based appointments, we have still managed to surpass our usual very high QoF standards. Indeed, 23 of our practices have achieved 100%, 4 have achieved above 99%, and 1 was on 97.5%, and that only because they had no patient in a particular disease category. This is an incredible achievement. Well done to all of you. Thank you to each and every one, and particular note must be paid to our brilliant data quality team with Angela at its head and Nicola supporting her and steering all of our practices to achieve these amazing results and phenomenal targets during these difficult and challenging circumstances. Another new positive initiative is the launch of SSP Health's Facebook group for staff. This is a closed group that you can all join, and hopefully it will keep us all connected and in touch with how other teams are doing. We're working in different ways, dispersed and not able to connect as we would do normally. So hopefully this digital connection will be welcomed by you. It's a place you can share good news, vent off some steam in a safe environment. And it's always helpful to share experiences with colleagues and to learn from each other how we're dealing with our own difficulties, because none of us is alone. The coming months will undoubtedly bring more challenges, and more changes will have to happen to adapt to what will become the new normal in our surgeries as we continue to practice new ways during the corona crisis. We can only do this as a team SSP, as we are all in this together. And so, despite the additional work we are all being asked to shoulder during the burden of coronavirus, I hope that you and your families can find some time to have a restful and peaceful Easter. Thank you.